Hi everybody, welcome back to another educational video with Piti Taiwo at Gladiolua. It's nice to have you all on this platform once again. In our last video, we discussed about not enduring pain, going to the hospital as fast as possible. One of the consequences of not going to the hospital as fast as possible when you are enduring pain is what we are going to be talking about today, and that is hypertension. When you endure headache, stress without addressing it as fast as possible, it leads to what we call hypertension. Today happens to be World Hypertension Day. We are doing it as a cause of awareness. We want to endeavor that everybody is aware about this hypertension of a thing that we're talking about. So if I want to talk about it in the layman understanding, I will break it into two terms, which is hyper and tension. We all know that tension means when somebody is under pressure, and hyper is when it's too much. Okay, so hypertension is extreme pressure happening in the blood vessels. Your blood vessels are the passageway where your blood moves around your whole body. Now, hypertension can cause a lot of problems, but one of the major problems, which is what we deal with a lot of times in most of our patients, is what we call stroke. And we do not want you to get to that extent before you address the issue. The faster you address it, the better. We are going to strictly be focusing on the physiotherapy aspect of hypertension. We use blood pressure as a guideline for us to know if somebody has pneumotension, hypertension, or hypotension. Hyper, as we say, high. Hypo, as we say, low. That one, we have the systole and we have the diastole. Okay, the systole is the one that is up, the diastole is the one that is down, and the range for systole is between 100 to 120. The range for diastole is between 60 to 80. What is the unit? The unit for blood pressure is millimeters mercury. Where do we now draw the curtain and say it is hyper? By the time you start looking at your blood pressure consistently, reason why it is advisable for every single household to at least have a blood pressure machine. Not just all about having the watch, the smartwatch that measures it for you at home. It's also wise that you have it in the house for the sake of those who do not have the smartwatch, and even for your sake. You don't have to, it is unusual for you to wake up in the morning and be putting the wristwatch around your wrist to check your blood pressure. So you have to have it at home. One of the physiotherapy relevant is that we are involved in prevention of cardiovascular risk. Cardiovascular risk, for instance, heart attack. So how does that happen? If we have a patient who had been on the ward for a long period of time, we begin treatment as fast as possible. We do not let the patient to be at a stagnant position for that long, take for instance 2 to 3 weeks, so that there will be no formation of clot to the blood vessels, which will now end up dislodging from where it was to the heart or even to the brain, causing stroke. But since we are talking about cardiovascular risk, the heart leading to heart attack, and that's a very serious situation we do not want. Then exercise prescription is guides the kind of exercises that we will be doing for the patient. We will now want to strictly sit on giving the patient aerobic exercises to patients, and guide the exercises aright, not letting the exercises to be strenuous, not letting even the repetition to be much, and also not letting the intensity to be much, because if we let these things to be much, it can cause problem, thereby causing too much pressure to the blood vessels to pump blood, and that's the reason why when we have a patient that is hypertensive, as we go along with the exercises, we tend to keep checking their blood pressure. And then there are even some exercises that will end up being eliminated, even though it is going to be useful for the patient, but because of the risk factor the patient already has, which is hypertension, we do not want it to lead to another bigger issue like stroke or like heart attack, as we know. Okay, so functional rehabilitation, it guides the forms of rehabilitations that we will give to the patient, the kind of exercises that will bring the person back to their near normal. Take for instance the patient who has sustained a severe motor accident and he has had an issue with one part of his body, and so because of the kind of job that he has or she has, we are trying to bring you back to being able to do those functions that you still were able to do before, to a large extent at least. Then lifestyle modification. If for instance now it is not possible for you to return back to your near normal due to one issue or the other, or that the hypertension is practically making it difficult for us to give you some forms of or many forms of exercises that will help you, we will now try to modify your lifestyles, like your diet, like your functional activities, like even your job. We could ask you what alternative form of job occupation can you pick up, so we can help you to fit into that job occupation without issues. So monitoring your response to activities, so we keep checking you. We can even be checking you every 10 minutes. Is as serious as that, because why? We do not want any issue to come up. Risk factors: sedentary lifestyle, when you sit down for a long period of time, or you're having an occupation that requires you not standing up. Take for instance, you are a secretary, you are a typewriter, an analyst that sits for long, or which other job occupation do we have there? Many others that do not require you moving around. Please, we are doing such jobs like that, you have to move around. They are very important for you, because movement, especially your legs, this one is very, very important. If you are not moving your legs, you are not returning the blood back to your body, because the leg requires your movement for blood to return back and for the oxygenated, that is the blood that has oxygen, to go to the leg. So if you are not moving your legs, you are causing problem for yourself, and there will be fatigue. Even to a large extent, you will see that most of your muscles are beginning to ache because they are lacking oxygenated blood, especially the lower limbs, that is your leg. So move as much as possible. When you are in the office, sit, stand and move around for like 10 minutes, come back, sit for like 30 minutes. Do that alternatively. It will help you a lot. Obesity, and that's where we say lifestyle modification. We try and look at your diet, to work with you to make sure that you are able to lose weight, and we even give you some exercises that will help as much as possible. Then stress. Rest is very important. I'm going to do a separate video about rest. Rest is very important to your body. Please do not joke with it. Rest as much as possible. Do not stress yourself, because the truth is this: if anything happens to you, life will still go on, and we do not want that to happen. Because why? You still have a lot of things to do on this planet here. Lot of people still depend on you. Please live a stress-free life. Then high salt intake. Reduce the number of salt that you put in your food. Reduce the number of junks that you put, because they also have salt in them. Okay. Smoking, alcohol, avoid them. There are many reasons to that. They cause a lot of other problems, which is not something that I'm going to be talking about here. Diabetes. If one has diabetes, you have to be extra careful with your diet, with every other thing. because even those who have diabetes, they are also at risk to developing hypertension. Most of our patients that have diabetes, you see that they have hypertension likewise. Then family history. Please know your family history. Know the conditions or the diseases that goes through the family that is causing from one generation to another. Know your family history to the extent that you already know what you are at risk of, because in some family, the family has history of diabetes. Let's say the grandparent has the history of diabetes. The fact that your parent didn't have it doesn't mean that you are excluded. The reason why they don't have it is because they've done everything possible to endeavor that they do not have it. So now the job falls on your own head because you are the owner of your body. You have a high possibility of having it likewise, and that's the reason why you should know your family history. If cancer has run through the family, or maybe one of the family member had cancer, there's a possibility of you also having it. So you try as much as possible to avoid anything that can trigger it. So that's the reason why family history is very important. Likewise for hypertension. Yes. Now, how do we do all these things? We have an assessment draft that we usually do. Subjective assessment, we check if the patient has history of hypertension. It's part of our questions that we have. Medication, if they are using antihypertensive medications. Symptoms, somebody who is having headache, who is having dizziness, and that's the reason why I spoke on the video that I posted earlier on this week, and that is, do not manage your pain, do not manage your symptoms. Go to the nearest hospital as long as you started feeling something that is out of the ordinary in your body as fast as possible. So if you're having these symptoms, headache, dizziness, blood vision, fatigue, what are you waiting for? Go to the hospital as fast as possible. Then your lifestyle habit, what do you eat, your drink, do you drink alcohol, do you smoke, is it socially, is it occasionally? Now the objective assessment is now coming to you. Okay, we are the ones assessing at this point. Now we check your blood pressure, we check your resting heart rate, see if even at rest. And that's the reason why when patients come to the hospital, we don't immediately start seeing them. We tell them to sit and rest, because we do not know the route at which you took to get to the hospital. If that you entered public transport, which can be very strenuous all the time, and if that you came with your own private vehicle, not that strenuous at all. So, but it doesn't still exempt the fact that we still tell you to sit and rest for at least maybe 10 to 15 minutes before we begin to start attending to you. And that's where we check your blood pressure to see if it is on a high rate. Okay, then that will help us. If the blood pressure is high, there's something we usually do. We tell you to rest again for another 30 minutes. We see that it is still high, then we refer you to the doctor, so the doctor can see what they can do for you. Then your BMI and your waist circumference, they want to see your body composition, and because there are risk factors for hypertension. It increases the vascular resistance, it restricts blood flow, as I said, fat when it is coating your blood vessels is made the pathway narrow. Okay, then it will also help us to design weight loss exercises program for you for your BP control, that's your blood pressure control. Functional capacity measurement, to measure how well the patient can perform with physical activity. So there are so many tests that we do for you. So we want to see how well you are able to tolerate exercises even under some form of intensity. Also monitoring your BP, your blood pressure. Do we notice? I'll list them out for you. Now we look at, when you are coming into the hospital, there's something like every physiotherapy does. They observe you from head to toe. They observe how you are moving. They observe how your facial expression is. They observe how your breathing is. So when they notice one or two little things there, they write it down as fast as possible. So now, what are these things that we see? Shortness of breath, okay, dizziness or poor balance, fatigue, visual disturbance, then uncontrolled hypertension. What is the safe threshold for me that I can say that okay, we can still treat you? The upper one, which is the systole, between 100 to 150, and then the down part between 60 to 90. For me, personally, I do not want to risk it. That is where I put mine, from 100 to 150 for the one above, and from 60 to 90 for the one down. By the time a person's blood pressure begins to start entering 200 for the one up, there's already a red flag for me. I will not do anything at that point in time. Now, what are the exercises we give for you? Aerobic exercises: walk, ride bicycle, swimming. Swimming is very important. I don't know how to overemphasize it, but swimming is very important. It's more or less like an exercise on its own. And the funniest part of it is that there's no how. I don't know about any other swimmer, but for me as a swimmer, there's no how that you will go and swim and you will come back home and you will not feel rejuvenated, you will not feel relaxed, you will not feel relieved, like as if you went to throw away all the stress in your body and all the tensions in your body. That is how cool swimming is. I advise that you learn how to swim. I advise it a lot. It's very, very good. It's one of the best form of exercises. In fact, it's a form of exercise that if you go at it for good 3 to 4 hours without a break, you will not be exhausted. Trust me on that. You will not be exhausted, and I really mean that. So you can do that, and you can be doing that, all those exercises like walking, bicycling, swimming, 3 to 5 days in a week. You can take 20 to 60 minutes in the day. Do you understand? Don't let the intensity be too much. Yes, don't walk too much, don't run too much. Let there be moderacy, and as I said, 20 to, in fact, 20 to 30 minutes is enough if you are an elderly person or you are an older adult. But if you are a young lady or you are a young guy, 20 to 60 minutes is still okay for you per day. Yes. Then resistance training, that's where you put in weight. Resistance, you put in weight. You can have a dumbbell that you can use, okay, and then you also learn how to breathe. Breathing exercises, yes, very, very important. Now, diaphragmatic breathing, relaxation, stress management. See, let me not lie about this. Those of us that love movies, I need to give you people kudos. Please don't stop. Hey God, don't stop. The reason is because the rate at which movies take your mind off lot of things is amusing. Like, you get to not think about the worries around you. You get to not think about what is going on, or what you've done, or what you have not done, or what you have achieved, or what you have not achieved. It takes your mind away. And most of the time, there's something I do. I watch mostly movies that make me laugh, and it helps a lot, especially when I see I'm stressed. If I'm seeing that I'm stressed, things are difficult for me, or I'm not finding one or two things easy, or I'm not happy about what I had gone throughout that day, I sit with movies that make me laugh, and believe me, I feel very relieved 100% of the time. Apart from even the movies, I listen to music also. So music therapy is very, very important. Listen to music. Do something that you enjoy. If it is books you enjoy reading, for me it's not book. Let me not lie about that. If books you enjoy reading, go ahead, do that. Take your mind off whatever it is that is going on around you. Okay, take your medication regularly, reduce your salt intake, exercise consistently, maintain healthy weight. Now know your BMI. So you check your weight in kilogram, you check your height in meters, and then you divide it weight over your height square. So you square your height, and then you put your weight up, you put your height down, and divide it to find your BMI. Avoid smoking and drinking excessive alcohol. Then monitor your blood pressure frequently. Check it as much as possible. Have the one manual machine in the house that you can use to check your BP in the morning and at night. Then if you are now at work outside your house, you can make use of your smartwatch that has the BP in it and can help you read it. Okay, thank you for joining me in learning about hypertension as we celebrate World Hypertension Day. I want us to share these videos to a lot of people that you can share it to, because knowledge is very important. As the Bible says, my people perish for lack of knowledge. Okay, I don't want us to perish. I don't want us to be ignorant. I want us to know these things, and that's one of the reasons why I started this educational platform which I have. We are still your number one plug in getting your BP machine if you want one. In fact, you can contact us on this number, and then we'll reach out to you and tell you the different forms of machines we have. Believe me, the best machines that I recommend to a lot of you, which I know works very well, gives accurate reading and lasts for a long period of time, is Home Run. I have one in my home. Right now I am not in the place where I place that machine, but of course I'm going to snap a picture of me with it and attach it to this video so that you will see it. Home Run is still the best that I can recommend to anybody, anytime, any day. Yes, it is expensive, but believe me, it is worth it. It is worth your money. It's a very fantastic machine. It even saves your readings that you had for a while. Okay, it works perfectly, reads it accurately. That is how good the machine is. Other machines last, but do not last for as long as Home Run does. There are some machines that last for 5 to 7 years, but Home Run lasts for 10-15 years without getting spoiled. And what even marvels me about this company is that they even still keep upgrading their machines. Okay, they keep upgrading their machines, and I love it. I love their machine, believe me. So I will recommend it for anybody, anytime, any day. You can save money to buy it. Please, you will not regret spending that money. All right, thank you for having me once again. It is World Hypertension Day. Spread the information to everybody by sharing this video with someone that will definitely need it. Bye.